The Women's Business Center of Richmond would like you to join us for our weekly Winning with WOW radio broadcast, hosted by yours truly, DrDanni, on ESPN Richmond 106.1 FM. Each segment features a woman boss who shares aspects of her entrepreneurial journey, designed to enlighten, uplift, and inspire. If you have business ownership aspirations, let us help. We can be reached at the WBC Richmond on our socials or thewbcrichmond.org, or you can call us at 804-525-9499.
Well, good morning, and thank you for joining the Winning with Women radio broadcast of the Women's Business Center of Richmond. I am your host, DrDanni, and the Executive Director of the Women's Business Center, located on the historic campus of Virginia Union University. And our radio broadcast runs each Wednesday at 5:30 a.m. on ESPN Richmond 106.1. And today, I am excited to talk with Miss Tracey Boseman. Tracey, if our listeners and viewers only had a short amount of time that they could spend with us this morning, what would you want them to walk away with? What nugget that you think might benefit them, but also stimulate them?
Well, that's a loaded question. But I think the thing to walk away with is, I think, knowing your self-worth, knowing what your value is, knowing that if a vision has been given to you, you can't expect everybody else to understand or support it, right? It's been given to you. Take it, take charge, kind of piece it together, get the business plan together, and move forward with what's been given to you. Anyone around you, they are simply going to be just that. They are people around you. It is up to you to learn your job of kind of conducting the orchestra. What you need from this person, what you need this person to do, what role this person plays, how this other person can help you, and utilize those resources of people that you have.
Outstanding. I mean, you kind of lay a very common sense and pragmatic approach to this whole idea around an entrepreneurial journey. Could you tell us a little bit about your business, the name of your business, how long you've been in business, and what are your products and services, and who do you serve?
Sure, absolutely. So the name of the business is Home Helpers. We are Home Helpers of Richmond and Chesterfield, to be exact. And what we do is we do senior care in the home, wherever our clients call home. Those different services that we offer range from personal care services or companionship services. So we may have someone that just needs a little extra help and assistance, someone that wants someone to stand by when they're in the home, someone that wants someone to come in and do their laundry, make a meal, take them to their doctor's appointment, make sure they take their medication. Those are our companionship level of services that we offer. Then we have someone that needs a bit more hands-on. Maybe they need toileting, maybe they need bathing, maybe they need help shaving. Whenever we're touching someone, that is personal care, and personal care is actually licensed by the Virginia Department of Health, Office of Licensure and Certification. And so that's pretty much what we do. When we look at the care that we do, a lot of it is geared towards our adults and our seniors, and it's done in the comfort of their home, wherever they choose to call home. So we have some of our clients that may be in a group home setting. They may be a veteran, and we have a fair size contract with the Veterans Administration to go into their home, which is the group home, and provide care. We have clients that are in their regular homes in the community, as well as assisted livings or independent living. And when they're in the hospital and rehab too, we go and we're there with them to be an advocate, to make sure they get the services, and to make sure the companionship keeps going. That socialization is very, very important when someone is feeling very isolated and when they have something that's hurting. So,
wow.
Mike Kingbiz here with On the Mic with Mike, the best business radio program around. I'm here with my good friend DrDanni of the world famous Women's Business Resource Center. We hear you guys have something exciting coming up.
New year, new business. Let's start 2023 off right and accelerate your time to money. On January 12th at 10:30 a.m., the Women's Business Center of Richmond, partnering with the SBA, will have a webinar that will speak directly to your business interest. New year, new business. You can find it on Eventbrite or on our website. Save the date, April 28th. The Women's Business Center of Richmond will be hosting our second annual Winning with Women and Minorities Conference, with this year's theme being Leading the Way. Join us at Lewis Ginter Botanical Gardens on April the 28th. For more details, you can go to winningwithwomenconference.org and take advantage of the early bird rate for registration.
How long has Home Helpers been in this area? And is it from the ground up your business, or is it a franchise that you bought into?
Great question. So it is a franchise. The franchise itself is going into its 26th successful year of business. I have had the business for 10 years, but with the other previous owners that were around, we've actually been in this area close to 20 years providing. But I think people know for the last 10 years, they kind of know who we are, and they definitely know to the quality which we try to provide to our clients for services that we extend.
Okay. Well, I mean, I want to dig a little bit deeper under the surface now that we have a sense of what it is you do. I want to know a little bit more about Tracey, and I think others would like to know that too. I seem to hear a little bit of an accent, but maybe you can share with us a little bit about how you got to this point, right?
Okay, well, that's a great one there too. So I am the daughter to a Jamaican descent dad who got on a boat at the age of 19 and sailed to Italy, and then went to his brother's home in London, all via a little letter that he had the perfect timing of receiving and making sure he was in the right place at the right time. My mom is South American. She is Guyanese from Georgetown, Guyana. And they met in London, England, and that's where they raised their children. So I am the middle child, very much, all things true of the middle child. I have an older sister.
Not the spare though, right?
I'm the older middle child, so that means
Okay.
There's a younger middle child. So I'm the second oldest of three girls, and then I have a younger brother who's the baby. So I was born and raised in London, England. Wanted to go in the police force. Most of my time I spent doing track and field events. That was my thing. I tried ballet at first. Just wasn't for me. And so I knew that I wanted a job that always pertained in the human services field. I wanted to be a policewoman. And I'm going to be a policewoman. I was all done. My paperwork was in London, and then I ended up moving to the States because my older sister was here. So I tried a number of jobs. Retail was great for me. I love meeting people. I love talking to people. I love helping people. So I went into retail when I did move to the country and spent a number of years in that. Then was married, had my son, and then retail was no longer a great fit.
Okay.
Very small course, and with that course, a young lady said, "Hey, the doctor's office I work at, which was huge, they're hiring." And so I ended up working there, and that was great. They had me in every department, felt like I was always an all-rounder, and I never really saw that in myself.
Okay.
Right? That was what everybody else kept saying to me, "Oh, you're such a leader. You're such a leader." And I was like, I don't see that. I cannot sit here and say I woke up and said, "Oh my God, I am going to own my own business. I am going to do X. I am going to do Y." I do remember my parents working extremely hard, and I do remember saying that when I got older, I just didn't want to work hard like that, or I wanted my parents to be extremely proud of who I am or what I was going to become, but not fully knowing, because originally I wanted to be a policeman, and they were thrilled with that.
Oh, wow.
As time went on and my children grew up, my son is a Penn State grad. My daughter currently attends Longwood. But just prior to that, I had friends that were doing home care up in Maryland area, and that's where I was. And I knew and befriended every single home care company.
Wow.
I was a hospice rep at that time. And I was with a large non-for-profit, and I took us from about 42 patients a day up to 191 patients in 18 months. And so my fiance, who attended Virginia Union University, and is a very, very diehard, proud alumni of VUU. We'd gotten engaged, and he said, well, if you're going to be moving to this area, why don't you capitalize and do something for yourself? And it made sense. I knew I wanted to do home care at that point when I was working hospice. That's when I truly feel like I found my fit. And I wanted to own my own business because I was able to see him own his business and said, that's what I want to do. And I want to be able to make decisions that couldn't be made sometimes when I worked in hospice, right? So that's when I decided that I was going to come to the Richmond area from Maryland and just figure out which company was going to be the best company for me. And I did a lot of searching and a lot of researching. And there were some factors at the time. It was a moratorium, so that means you couldn't get a license to do personal care.
So talk about the licensing process. I don't know if you have a healthcare background. Did you said you were in hospice before. So I guess my question is, what kind of credentialing or experience do you need to be able to have the type or buy into the type of firm that you ultimately are there to render this home care?
Right. So Home Helpers does a screening and a background, and they just don't take everybody. Is this going to be a good investment for this person? Because, today I'm sure it's probably in excess of about, $50,000 or $60,000 plus that you need for startup.
Okay.
So, they will look at your background. There are some people that have done business. There are some people that have been in nursing. Some people have been in social work. Some people that were in medical sales. There's some people that haven't done any of the above and have come in and have been very successful. They've been PAs. So really it's about the business fit and the mindset that you have. And so when you work with a franchise, for example, they basically do like a meet the team and a discovery day to find out a little bit more of an in-person situation. I've met people who are in the home care industry, and again, they've been all of different types of backgrounds. So there's not like a one shoe, like you've got to be in the medical field.
Okay.
Cause some people to do it, usually an experience sometimes where people went through an experience. And some people have seen that there are aging seniors that just need that help, and they're trying to find a way to kind of, how do we assist our community with a cry that there is for senior care.
Yeah.
It really is that they kind of go through, kind of talk with you, figure out if this is going to be a fit for you. My background, I was in the medical field after I had my son. So, I'm knocking at 26 years, of having been in the medical field, going up to 27 towards the end of this year. So it kind of allowed me to kind of have a look around. But the things I did initially was I did a medical assistant, then I did a physician's office, and then I kind of managed that office. And then I went into health insurance. I did a lot of different health insurance providers in the Maryland area.
Okay.
I liked the healthcare field.
Yeah. So, I want to go back to the statement that you made when we opened up, and that is, you have to know yourself and understand that some people are not going to see your vision. Your vision is for you. And I think sometimes, our audience within the Women's Business Center, as well as ESPN Richmond 106.1, I think sometimes, let's say that we are targeting or we're speaking to those individuals who are sitting on the fence. Either they are partly involved in business as a side hustle, or they envision being in business, but they haven't made a decision to take that jump. And so when you talk about, a lot of times people talk to other people, this piece about knowing that if there's this thing in you and you've got to give birth to it, other people may not see it, and maybe they're not even meant to be trusted with this vision. You've got to find out what you need to do and then press forward. Did you run into any kind of either naysayers or questioners? It sounds like your fiance was very supportive, or did you have anything internal that you had to overcome that made you just say, bam, I'm going forward even despite any potential obstacles?
The internal naysayer was me. That was me. The internal struggle sometimes can still be me, right? If I say, I'm going to do this, I say, no, that won't work. I think when you're given your vision, the other part is that, yes, not everybody is going to understand it. It's just what I just said earlier, find that client, that aid, find her, find your people. Find the Women Business Center of Richmond. Find people that understand what it is you're trying to do. I remember someone many years ago, to the church that we went to visit many years ago, and the preacher said, if you want to own a home, don't hang out. You can't get that info from your friends that might still be living in an apartment. Right? You have to surround yourself with people that own homes, because you suddenly find yourself owning a home. You will start to take that path. Your friends will talk to you about it. Your other friends may not be able to. So the other thing, what my girlfriend said to me in Maryland many years ago, who was in home care, and when I was trying to do, a little of both, right? Side hustle, I'd already gotten a business, didn't come down for a year. Your loyalty lies where your check lies.
Your loyalty lies
Yeah.
where your check lies.
Right. So if
Okay.
you have a full-time job over here, like I did in hospice, figures a year,
Yes.
loyalty lies where your check lies, because you are so comfortable, and I think you have to be, that internal struggle is, okay, my loyalty is here, but when I get to this amount, 3 clients, 5 clients, when I earn X amount, 5,000 a month, 9,000 a month. When I earn X, then my loyalty is going to shift.
Okay.
So you have to have that, I always feel like, as a part of your business plan, to be able to commit to yourself and to make your loyalty lie where your check lies, right? It was a struggle. And I said 9 years of research, and that was really true.
Wow. But you also, it sounds as though you were skill building along the way. And there seems like so many aspects of the healthcare supply chain, you were engaged in one part or another. So it puts you in a position to be a real asset to your business, not just having a desire, but having the core competencies to create a successful business. Maybe you could tell me a little bit about some of the challenges. A lot of businesses post-pandemic have been talking about the challenge of finding talent. And I'm curious to know, are your people 1099 people, or do you have an employment base and you supplement? And how challenging has it been for you to be able to keep your staff lined up with the demand for your business?
Great question. So we actually sustained through the pandemic. We did definitely dip down, but as the demands of our business rose again, so did our staffing needs, and we were able to align them both usually pretty well. We made some changes recently in the office, and that has been an absolute blessing for both people to kind of shift a little bit. But we have been able to get talented staff. It does still remain a journey in getting talented staff. Might hire 10, maybe 6 are really, really awesome. Maybe someone decides soon after that we had someone that was going to go and become a paramedic, and someone else is going off to physician assistant school and finishing up being an RN. But for the most part, we try to really seek quality people. At times, it has been difficult. Right now, for example, today, Amber has 8 people that she's either interviewing or they're coming into the office to finish up orientation to be able to be given a schedule and go to work. So that for us has been absolutely tremendous. And we kind of made the shift right around the Christmas time frame. So it's still very new for us, but it's working very, very well. We try to partner with sometimes schools. If there's someone who's in, the RN programs and they hours around, the RN program. We recently hired a nurse week before last. She's over at South University. She's finishing up. She's another year, and she wants nights. She's like, I can do Saturday night and Sunday night because I'm in school, and I can do this afternoon. Awesome. We have, I guess, continued to plug along, so much so, we own our building here on Twitridge Lane. We purchased this December 2019.
Congratulations.
Year in October of 2020. During the pandemic, we purchased another little condo 2 doors down. And then we just closed on a building on November 30th on Homeview Drive, right off of West Broad Street up in the West End for our West End location. We started on the West End, we migrated here in 2014, July of 2014, and now we'll be split where we have 2 locations. So for us, it's been business as usual. I think our name is what has really helped us. Just like you said, the leaning on other people, the other business owners. I talked to 2 other home helper owners just yesterday, and I spoke to another girlfriend that's in home care in Maryland also yesterday. So so it's finding your people, finding people that understand what you're going through. There are challenges out there, but I've always been like this since hospice. As long as my business is here, and as long as there's another home care, there's home care workers. And one of our regional persons once taught me, Tracey, the way that you get your employees is 4 ways: beg, borrow, buy, or steal, kind of pick. And so we do a little of each where we have to. You borrow them, they may work for us, they may work for a company down the street. I partner with other owners and other companies locally. One is in Ashland, one is literally across the street, maybe a half a mile away, and I'm meeting with him tomorrow evening. So I make sure, finding my people, what are our challenges, and finding different ways to overcome them. And that's when a franchise is also a really great support for us as well. But our goal is to get more in tune with places like the Women's Business Center that we need to be a part of, right? We need to share our story. There's no one that's ever come to me and will ever say that I didn't sit down with them and give them information, because I'm excited and I feel like the more of us there is, the more opportunity there is.
Yeah. I think that you kind of hit the nail on the head. Finding your people, and your people may evolve over time, but I know my kids always talk about my tribe, but it's where you give it, you get energy, you give energy, and you grow. And
Yes.
the thing that I that's the part I guess that really touches me is that methodically you went through this, and then there's benefits for the folks that you employ, the people that you serve. One of the things that it seemed that you did well, although we didn't touch on it, before we close, I want to get this question in, is oftentimes I found business owners, whether they start a franchise or otherwise, they're caught in the operations, the day-to-day operations. They're more involved in that. And so we know that operations tend to be more tactical rather than strategic. It would appear, and I heard you mention the young lady who is interviewing people on a regular basis, that you have found a good support staff so that you can be that executive. And did you have to have that transition in terms of, okay, now I need someone who's going to focus on this so I could make sure the whole picture is coming together? Or were you always that, person in that position and hiring the right people around you?
So it was actually swapping 2 members of staff.
Okay.
Right. So one person was scheduling, one person was doing the interviewing. And it just wasn't, we just were like a hamster on a wheel. We were staying. We've seen a lot of people come in. I took 2 office personnel to Denver. Let's go see how they run their office in Denver.
Okay.
And we spent about 3 days up there, and it was wonderful. And I came back, and with the person, we spoke with the person that was doing the scheduling. It's like, okay, how do we work through this? Let's try to swap for a bit. Gives everybody a break. Burnout is real. People don't want to leave your organization, but they may want to go back to doing something different. And it has just worked right now, really, really well. So I've been able to actually get the other person up with the interview, and she has brought new ideas, implemented different things. So now when I go to get my young lady back who was interviewing, who's in scheduling right now, and migrate her to the West End, now there are different things that are put in place, different communication patterns. And now I still have two interviewers, basically, two recruiters at two different locations that both get it and both now are able to communicate and both still able to schedule, because that's critical. The other part I would say is interesting that we're doing this now. On Saturday, we had an appreciation lunch for our caregivers from 1 to 5 at Kickback Jack's restaurant over Midlothian Turnpike. We had about 35, 36 of us in total. And I don't think there was an employee that left without speaking to. There's 8 of us in administration here, really 9. No one left without saying thank you. And I had aides that I haven't had a chance to fully engage or know. There's 90 of us in total, maybe a little over now. And they came up and said, this was absolutely wonderful. And I want you to know, I feel appreciated.
Oh, wow.
So the biggest thing is, the people that are doing your work for you, when you find your people, they are your people.
Yeah.
They're part of your team, whether they're in the field every day, going from home to work and work to home. And my RNs come and say, they're so isolated. What can we do? We do things during the holiday season to recognize people. We do gifts every holiday. The one young lady that came up to me first to say that she never felt so appreciated in her life, and this was wonderful.
Wow.
I have one request. She said is that we do it 2 times a year. And I said, it's already on the books. Because just from the feedback that we got, how wonderful it is, and that they deserve it, because they are doing what it takes to grow the business and to provide good care.
Yeah. I spent a number of years in corporate America, and I will tell you the most valuable asset that I ever had as a leader was to hire well, to recognize and reward talent, the behaviors. If you take care of your employees, they will take care of your clients.
Yes,
and so that's what I hear coming from you. So how do people get in contact with Home Helpers? In terms of your website and things like that, share that. Give a shout out to.
So always looking for people just to call, have conversations if they have a loved one, especially if they have a veteran. Veteran has a great program where people can sometimes get up to 34 hours a week of care, and that is huge. So they can call us, 804-864-4258. We are definitely on the internet. We are www.homehelpershomecare.com/Richmond. And we are also on Facebook, Home Helpers, Home Care, Home Helpers of Richmond.
Home Helpers of Richmond.
Find it, yes.
Excellent. So thank you for joining us today. Thank you for such an enriching and enlightening exchange about your business and your entrepreneurial journey. I am Dr. Danny, your host of the Women's Business Center of Richmond's radio broadcast with ESPN Richmond 106.1. Thank you and have a great day.